Paige. How are you feeling today?
I'm starting to feel sick again.
Can you tell me what's bothering you?
Well, I keep getting fevers and nosebleeds, my gums hurt, and my head hurts, and I'm really tired.
Have you noticed any lumps around your neck or abdomen?
Yeah, I noticed this lump right here on my neck.
I do see somewhat of a lump there. Maybe I can help you out. Paige is a cancer patient who has been battling leukemia for the past 3 months. Leukemia is a cancer of the body's blood-forming tissues, bone marrow, and the lymphatic system. It usually starts in the white blood cells when the bone marrow produces abnormal cells that don't function properly. Paige was diagnosed with acute lymphocytic leukemia 3 months ago. It is the most common type of cancer found in children.
ALL occurs when a bone marrow cell develops errors in its DNA. The errors tell the cell to continue growing and dividing instead of a healthy cell, which normally stops dividing and dies. In my case, bone marrow produced immature cells that developed into lymphoblasts, which didn't function properly and crowded the healthy cells.
This is a picture showing the abnormal cells within bone marrow. In normal bone marrow, you won't have as crowded white blood cells, meaning that the cells are functioning properly and they're not cancerous. However, in ALL, you have abnormal proliferation of these cells in your bone marrow, which negatively affects your health. Up to 65% of leukemia cancers contain translocations where genes on the chromosomes are swapped or shuffled. The most common translocation in ALL is the Philadelphia PH chromosome, where DNA is swapped between chromosomes 9 and 22. It occurs in about 20 to 30% of adults and 3 to 5% of children. Another form of translocation in ALL is TEL-AML1 fusion. This occurs in about 20% of patients and may even occur during fetal development. This is one of the translocations that will occur in patients with ALL. Here, before translocation occurs, on the 9th chromosome you have an ABL gene. And then on the 22nd chromosome you will have a gene that is BCR. However, after the translocation occurs, both of the chromosomes switch their genes, creating the Philadelphia chromosome, which leads to patients with ALL.
Symptoms include bleeding from gums, bone pain, fever, frequent infections, frequent or severe nosebleeds, lumps caused by swollen lymph nodes in or around the neck, underarm, abdomen, groin, pale skin, shortness of breath, weakness, fatigue, or a general decrease in energy. As for treatment of ALL, we suggest chemotherapy, radiation, stem cell transplant, and certain medications. Radiation therapy uses high-powered beams, such as X-rays, to kill cancer cells. This is recommended if the cancer cells spread to the central nervous system. A stem cell transplant may be used as consolidation therapy in people at high risk of relapse or for treating relapse when it occurs. This procedure allows someone with leukemia to reestablish healthy stem cells by replacing leukemic bone marrow with leukemic-free marrow from a healthy person. I have gone through a few rounds of chemotherapy to treat my leukemia. Chemotherapy drugs interfere with the cancer cell's ability to divide and reproduce. Chemo drugs may be applied into the bloodstream to attack cancer cells throughout the body, and they can be delivered directly to specific cancer sites. Chemotherapy helped to put me in remission, but now I'm noticing symptoms of ALL again. More than 95% of children with ALL will attain remission. However, some studies indicate a better prognosis for girls than boys, and survival rates for African American children and Hispanics are lower. Adults with ALL will usually have a more severe condition than children, but still 60 to 80% of adults will achieve full remission. ALL is the cause of about 1,400 deaths in the U.S. each year. However, it's one of the most curable cancers, and its survival rates are at an all-time high right now. This is a graph showing the survival rates of children under 15 years old with acute lymphocytic leukemia. And as you can see, from 1964 to 2004, the survival rates increased. So I have a good chance of surviving with leukemia. Keep in mind that certain factors may affect the prognosis, like age, white blood cell count, chromosome translocations, and response to chemotherapy.
Inside the hollow area of the bones is a spongy core called bone marrow. It is here that stem cells are produced. Stem cells are immature cells that can develop into components of blood. Red blood cells, which carry oxygen to the body. White blood cells, or lymphocytes, which fight infection. and platelets, which help blood to clot. Acute lymphocytic leukemia, ALL, is a cancer of the stem cells in the bone marrow that produce lymphocytes. The term acute means the cancer cells multiply rapidly, crowding out the normal cells in the blood and bone marrow. In addition, as the number of unhealthy lymphocytes in the blood and bone marrow increases, fewer red blood cells and platelets are produced. If the bone marrow is unable to produce enough healthy lymphocytes, the patient will be unable to fight infections. The leukemia cells can travel in the bloodstream or metastasize to other organs in the body where they begin to form additional tumors. Common symptoms of ALL include persistent fever, fatigue, bleeding, easy bruising, and swollen lymph nodes. Chemotherapy is the first line of treatment aimed at destroying the leukemia cells and allowing normal blood cells to grow. Radiation therapy, biologic therapy, and bone marrow transplantation may also be used if chemotherapy is unsuccessful. Acute lymphocytic leukemia is the most common cancer in young children. However, nearly 80% of all children with ALL can be cured.
The best way to reduce your risk of ALL is by avoiding contact to certain toxins, radiation, and chemicals. Due to the random genetic rearrangements, it is hard to fully prevent it.